Difference between nursing in Kenya versus nursing in the UK. Education and training. In the UK, nursing education typically requires a bachelor's degree in nursing or a related field, and nurses are required to be registered with the Nursing and Midwifery Council (NMC) to practice. This means that nurses in the UK receive a more comprehensive education, including coursework in nursing theory, research, and evidence-based practice. In contrast, nursing education in Kenya typically requires a diploma in nursing or a related field, and nurses are required to be registered with the Nursing Council of Kenya to practice. While the education and training requirements in Kenya are also rigorous, they may not be as comprehensive as those in the UK. Scope of practice. In the UK, nurses have a broad scope of practice and are involved in a wide range of patient care activities, including administering medications, providing patient education, and coordinating care plans. They also have a higher degree of autonomy and responsibility than nurses in Kenya, with the ability to make clinical decisions and order diagnostic tests. In contrast, nurses in Kenya also have a broad scope of practice, but they may be more limited in terms of the types of procedures and interventions they can perform due to differences in regulations and resources. Salary. Nurses in the UK generally earn higher salaries than nurses in Kenya, although the cost of living is also higher in the UK. The starting salary for a newly qualified nurse in the UK is around £24,907 per year, whereas in Kenya, the starting salary for a registered nurse is around £43,000 per month, equivalent to around £269 per month. While this difference in salary is significant, it is also important to consider the differences in the cost of living and the availability of resources in each country. Workload and staffing. Nurses in Kenya often work longer hours and have higher patient-to-nurse ratios than nurses in the UK. This can lead to higher levels of stress and burnout among Kenyan nurses, as well as potential risks to patient safety. In the UK, nurses have access to more resources and support, including technology, medications, and equipment, which can help to reduce the workload and improve patient outcomes. Access to resources. Nurses in the UK generally have better access to resources such as technology, medications, and equipment than nurses in Kenya, due to differences in healthcare infrastructure and funding. This can have a significant impact on the quality of care that nurses are able to provide and can also impact job satisfaction and burnout rates. Overall, while there are similarities in the roles and responsibilities of nurses in the UK and Kenya, there are also significant differences in terms of education and training, scope of practice, salary, workload and staffing, and access to resources. Understanding these differences is important for nurses who are considering practicing in other countries, as well as for policymakers and healthcare leaders who are working to improve healthcare systems and outcomes in both the UK and Kenya.